Well, at Intermountain Healthcare, we do have a program called Mental Health Integration, which we use with our primary care providers. And mental health integration means that we try to integrate that kind of care into our regular pediatric and adult medicine care in the primary care clinics and family medicine, internal medicine, and pediatric clinics. And what we do is we do some screenings on each patient that comes in for routine physical exams and well exams. For example, in pediatrics, for all of our adolescents, we do a little survey for both the parent and the child that talks about issues that come up for kids during their growing up years as far as their mental health goes. And that'll include questions like, do you think you have excessive worry? Do you feel hopeless and depressed? Are you having other difficulties? It asks a lot of other screening questions about situations in the home. And that's just a routine so that the patient and the family can hopefully feel good about talking about those things. It's also a trigger for us as providers to say, oh, maybe there's an issue here that we need to discuss. And when that happens, then we do a more in-depth screening process. And if someone has significant symptoms, then we determine, is this something that we can take care of in the primary care clinic? Or do we need to have mental health workers be involved with us in the care? And with our program, what happens is we actually have mental health workers who come into our primary care clinic. Because there are a lot of people that have difficulty going from their primary care provider to a mental health worker, whether it's a counselor or a psychiatrist, because of the stigma they feel from the culture. We are trying to reduce that significantly, and we've made great inroads, I think, in the last 10 years or so. That the public understands that mental illness is a real medical condition. It's not just something where people can't handle their situations and they need to buck up and that kind of thing. But there still is that feeling of, why can't I get through this on my own? So we have psychologists, psychologists and therapists, counselors, who can come into the clinic and do some of those assessments. Now, if somebody needs long-term therapy, then they've already established a relationship with that individual, and they can go and see them in their regular office. But a lot of times it's just a few visits for some of the mental health issues that we see in young people. You know, they've had some kind of a situation that really has knocked them over or pushed them into a hole that they can't get out of now, whether that's a death in the family, divorce, or other kinds of trauma. Sometimes it's the death of a friend at school, and we know by our own experience that there are a lot of young people who really worry about that when their friends commit suicide or have a significant problem. They really feel attached, and they become very caught up in that, and so that can really stress them out. So sometimes it's just a few visits to do that. But other times, they need more extensive therapy, such as medication or long-term therapy. The studies show that both for depression and for anxiety in children and adolescents, that medication, starting usually with what's called a selective serotonin reuptake inhibitor, or SSRI for short, such as Prozac, which is fluoxetine, or Celexa, which is citalopram, that those are the first-line drugs that we use, but that the medications in combination with therapy are the most effective treatment. So a lot of people want to start with one or the other. You know, they're really hesitant about medication, so they say, okay, I want to go to a therapist, or I don't want to talk to anybody. And a lot of youth will say that. You know, it doesn't help to talk about it. So we sometimes will start with a medication, and as they start to feel better, they're more willing to talk. But there are times where just one of those therapies will help them significantly through their problems, so they don't have to go to the other modality, as we call it, and we can help them. Obviously, the biggest worry we have about mental health in young people is the risk of suicide, and we know that that's a huge problem in Utah. It's actually the leading cause of death in young people between the ages of 10 and 24. Second leading cause of death in young adults between 25 and 44. So it's a significant problem, and we're not sure why it's more prominent, more prevalent, I should say, today than it was years ago. But part of it's probably cultural expectations. The feeling, a lot of people seem to feel overwhelmed by what goes on in their lives. But whatever the reason, we need to be alert to those things. And so there are some signs that parents can look for. Teenagers and children and teenagers often will not just get sad and withdrawn. They tend to act out and get angry. Sometimes they have high-risk behaviors, which can be a sign not just of depression, but of other significant mental illness, such as bipolar disorder. So they will act out sexually. They will take risks in that kind of behavior, or they'll begin to self-medicate with drugs, especially marijuana. And in Utah, another significant drug that a lot of people turn to is a narcotic, often starting with prescription drugs such as Lortab or hydrocodone, which is what is in Lortab. They often start with prescription, but they're so expensive to get that they then move to heroin. There are more deaths in Utah every year from drug overdoses, from narcotics, than there are from car accidents. So these things all kind of come together. And obviously people who are addicted to drugs have more risk to commit suicide as well. So all of these things are warning signs. They'll withdraw from their friends and not want to do activities that they would normally do. Young people actually start saying sometimes they don't want to be here. They don't necessarily talk about death, but they say, I wish I were never born. And so those are warning signs for parents. There are children who, when they get angry, will sometimes say, I wish you never had me, or something like that, in a fit of rage. But if that's a common theme in their, they seem really down in the dumps, or they're acting out and they say, well, I wish you'd have never had me, and I wish I wasn't here. That's an indicator that we probably ought to evaluate them more fully, and hopefully we can help them before they go further down that road. Well, there isn't really a typical age for getting mental illness, other than it's usually there, at least in school. But certainly we do see kids who are preschoolers who have a lot of difficulties. There are a lot of mental health issues that are associated with autism, for example. And so autism is something that we used to not be able to really pick up until at least 3 or 4 years of age. Now we've got screening tools that help us pick that up more in toddlerhood, down to as young as 18 to 24 months of age. And we find that early intervention with that problem helps a lot. So we sometimes will see really young children that are helped by some of these medicines. But most of the time it's school age, and it really picks up in the teenage years. There's a lot of peer pressure, there are academic expectations, there's their interactions online. And the more we learn about online social media activity, the more we realize that it creates a real dissonance in the lives of young people, because they look online and the best is presented there from their friends, and look how great my life is, and their life's not like that. The truth is, neither is that other person's life like that, but it's it creates this false sense of what other people are doing and how much better their life is than mine. And so that dissonance can create more anxiety and depression, which then can lead to worse situations. Resilience in young people is really important. And we're not creating that resilience very well in our culture right now. Now, there are efforts to change that. But one of the good things about the philosophy of the yesteryear of, you just have to kind of push through it, was that the people who really did well in that environment improved in their resilience. And now we have more of a culture of support and helping and being positive all the time. And those are really important things, obviously. Looking back on my own childhood, I wish I'd had a little bit more of that in some areas of my life. But it also creates, it's very difficult to find that balance, because it creates this idea that everything should always go well for me, because if my parents always step in and intervene with my teacher or in my relationships with other people, then I don't learn how to do that. And the social media, again, has contributed in a way, because we don't have, it's a distant kind of interaction, and we're willing to say and do things on social media that we wouldn't do sometimes in real life. On the flip side of, I'm putting my best face forward on Facebook, I also can say the meanest things, because I don't really think about the other person that's on the other side. So that's where cyberbullying comes in, and it's a very interesting dichotomy. But we don't have, a lot of our children don't have the tools to deal with that. And we're finding our way as a culture in that regard. I have young adult children, and their experience as a young adult is very different than my experience as a young adult was. And I don't think that my experience was better or that their experience is better. But we have to figure out how do we navigate those things and help our kids so that it doesn't turn into a mental health problem because of that dissonance of what I should be doing or how I should feel and how I really feel.